The views and opinions expressed during this program are those of the hosts, guests, and callers and are not necessarily those of this station, its management, or other employees, advertisers, or sponsors.
Good morning. It is Wednesday, January 15th. I'm Michelle Dials, and you're listening to Talk of the Town on 1230 WSAL. Joining me this morning from Logansport Memorial Hospital, Vicki Bird is here. Good morning.
Good morning. How are you today?
Doing well. And this is a little later than your normal day that you would be here, but we had New Year's Day and then we had the snowstorm.
That's right.
So we were able to get you in today, and we're glad you're here.
Thank you.
And you have a special guest with you this morning.
I do. I have one of our newest physicians with us, Dr. Namita Segal, and Dr. Segal is with our pediatrics office, and so we're here to welcome her and learn a little bit more about her today.
All right, fantastic. Welcome, Dr. Segal.
Thank you, Michelle. Thank you, Vicki.
You're welcome. Now, you have been here, you said, since around the 1st of November?
Yes, I started here on the 1st of November.
On the 1st of November. So you've been through some of our winter weather and that
yes,
sort of thing.
I hope never to go through this kind of weather again.
Now, what is your background? Where are you from?
I'm originally from India. I did my medical school in India, and then I came here in 1988. I did my residency in New York. And then I did a fellowship in neonatology at Stony Brook on Long Island. And then I came to Kansas to work at the Kansas University Medical Center as a neonatologist. And I was there for 8 years and then decided to go into private practice as a general pediatrician. And I was in Kansas till this year. And then I came to Logansport because I came for my interview. I was very impressed with the hospital, and the opportunities that I could see were very likely and possible. And so I accepted the job here.
Well, what a great story. I mean, it's great to have you. What is a neonatologist?
A neonatologist is a physician who's trained in taking care of newborn babies. Neonates are babies that are classified until they are 28 days old, but we are also trained in taking care of premature babies, all the complications of preemie babies, and any complications of full-term babies, and what to do with babies that are born with defects, any baby that needs additional support, any baby that needs help. And we primarily take care of them until they're ready to leave the hospital.
Okay. Now, as far as the pediatric side of things, is it all children that pediatricians work with?
We take care of children until they're 18, but at the age of 18, if a child who has special needs and has been very comfortable with their pediatrician chooses to continue with their pediatrician, they can still do that until they're 21. Because sometimes they're very comfortable, they've got special needs, and they just want to continue with their doctor who they've established a rapport with. So they can continue till they're 21.
Now, how does someone establish a relationship for their child with a pediatrician? Is it referral, or are you taking new patients, I guess?
I was wondering what that is. Yes, I am taking new patients.
And they would just call to?
They would call the office, and I guess Vicki would be the better person to answer that.
We do. I mean, our pediatricians, we have 3 pediatricians now, Dr. Pulaski, Dr. Ahoni, and now Dr. Segal, and all of the physicians do accept new patients. So they can call. And oftentimes when it's a newborn, the doctors, they see them in the unit, and so then that's also how they begin their relationship with a pediatrician at the hospital.
Okay. And at any age, a child could then become a patient of yours,
yes.
Up to 18?
Yes.
Okay. As far as you mentioned some of the opportunities at Logansport Memorial Hospital and that they were very interesting to you. Do you want to kind of talk about what some of the things were that attracted you to Logansport Memorial?
Sure. One of the first things I was very attracted to is the staff. When I came for my interview, I visited the clinic, I visited the newborn nursery, I met with the managers for all the units, and the staff was just so nice and friendly. And I'll tell you that I came here, I'm by myself. My husband is still in Kansas. My daughter's in college. My son, when I moved, he had to leave school in Kansas, and he's in Culver. So at one sudden swoop, I felt that I've lost both my kids, I've lost my husband, I've lost my little Zena, that's my little Lasapu, and I'm by myself. And it was very depressing. And I don't think I would have survived so long if it wasn't for the love from my staff. They've just taken me on and have been my extended family. And I never feel sad when I'm at work. And I don't even call it work. It's like being in my home. So the staff is wonderful. They provide a lot of support, so I really enjoy, and I saw that my first walkthrough in the hospital, and they were very interesting to talk to, and I'll tell you, I went for an interview before I accepted the Logansport opportunity, and I saw the staff in that clinic, and they were just lifeless. When I talked to them about, so this is what we could do in this clinic. Yeah. I didn't know if they were awake, if they were sleeping. They had no interest at all in what we could do with the clinic. And over here, everyone was just, oh, that would be wonderful. We could do this, we could do that, we could do different types of forms. And that's one of the things that you want to hear, that the staff is looking at new ideas and in new thoughts. And then I went to the nursery, and that's one of my pet things, that nurseries and developing more ideas and taking the nursery on to a next level. So I met with the nurse manager, and they were very interested in whatever my background could bring to the nursery, and I really like that. The fact that you're interested in what we can do and that we could bring new thoughts, new ideas, new equipment into the nursery, and she expressed that right at the visit in my interview, and that was very encouraging to me. I don't want to be in a place that's stagnant. I want to be in a place that's looking at new creativity and new ideas. And basically, we're all here for one thing, and that's our patients. We're not here for ourselves, we're here for our patients. And that's what I liked about the hospital.
What an awesome testament to what's going on at the hospital. I mean, we talk every month, Vicki, about some of the things that you guys are working toward. And I know that new ideas, you guys are always open to approaching that. But what a great story.
It is a great story. And I've not heard it. I'm just like, oh, wow. And, we talk about how great our staff are. And I mean, it's true. And it's not just, the pediatrics office and the OB unit. I mean, it's throughout the hospital, and it's really nice to hear that.
And it is. I mean, people I don't know will come up to me in the halls and say, Dr. Segal, I haven't met you, but I'm so-and-so. And I can walk up to anyone and say, hi, I'm Dr. Segal. Oh, yes, we've heard about you. And it's just such a homely atmosphere. And I have to give my greatest thanks to Jim Schrader, because he reached out to me again and again after the interview. And he just roped me in.
Well, we're very glad you're here. It sounds like you have lots of great ideas. As far as patients, I know we've talked in the past, Vicki, about health needs within the community, and are people locally following through with having their kids see a pediatrician as needed, or is that another area where we have opportunities to grow? I mean, is that something where people are following the common practices?
Well, I am seeing, so when I pick up a baby in the delivery room, I set up my schedule that I want you to come back at a week and at a month. So I'd say 80% of them are coming back on the schedule that I set up. There are some that slip through. They are not following up at all. So we are trying to call them and find out why. We're trying to reschedule with those babies. So they are the patients who I've got identified to know that, yes, you need to come to me. And in most cases, we are being able to track them down and reschedule them. The other patients, I have sick visits who are coming to me, and I reschedule them for follow-ups and look back at their charts and let them know that you have a well child visit to schedule. The rest of the kids that I personally am getting are from a previous pediatrician, Dr. Reyes. Now, those I'm sorry I can't address as to what their well child needs would be, because they're children who I have not had under my umbrella yet. But in my own practice in Kansas, I would have a system where my nurse would have a docket where everyone would be in a rotation of following up on their well childs every year or as needed. But since I'm trying to catch up on someone else's kids, it's a little bit hard for me to know who was seen, who wasn't, and because I'm playing catch up with another group of patients.
I guess I would just say that, as we've talked a lot about just general health and wellness here, that it is important, and we talk about how it's important for older or adults to get their annuals and their required screenings and those kind of things. Well, it's the same thing with the checkups for kids. I mean, at certain intervals in a child's growing or maturing stage, they really should see their pediatrician for that check, as well as that's also the time when they're recommended to get their immunizations. And it's really important that they get their immunizations for their own health and well-being as well. So that's why, if if that's not something that a parent regularly schedules, it really is important. And again, they can call our office at any time and get scheduled with one of our pediatricians and become a patient at the pediatrics clinic. The other, we've done this long enough and I've talked, enough times. The other issue then is we know that there are some general health issues that are common throughout our community that, again, it's another reason to be established with a physician. The obesity level in our community is higher than the state and national average, and it is also higher among children as well as adults. So, that's something that, we need to pay attention to, as well as we have a high incidence of asthma in this community. And again, that's an issue that, I don't know if Dr. Segal has seen much of that since she's been here, but it is an issue in this community. We just, again, recently affirmed that through the Community Health Needs Assessment. And, so again, those are two more reasons, and there are a lot of other reasons beyond that, to establish with a pediatrician. The other thing that we've just recently received, it's not been officially announced, but I can probably talk about it anyway. We just received an infant mortality grant. And basically, it's a grant that will run for 18 months, and it's money to help us address infant mortality issues. We also have a high incidence of women who don't of pregnant women who don't seek medical care in the first trimester, and that is so important. And so through this grant opportunity, which will start in April, we'll be able to hopefully increase that percentage of women, to urge them or to get their prenatal care started in that first trimester, to address smoking during pregnancy. That's also one of the things we just found in the community health needs assessment, that there's a significantly higher percentage of women that smoke during their pregnancy, and that can cause major problems for the baby, as well as some other issues too. So we're pleased that we received that grant, and over the next couple months we'll be doing some planning, and the community will be hearing more about that as well. But that goes hand in hand with what the pediatrics office is doing too.
Very interesting. Now, as far as this time of year, I know there's a lot of information out there about the flu and that sort of thing. Are there particular things that you've seen in the time that you've been here?
There's a lot of flu. I'm having a lot of children under the age of 3 that are coming in with bronchiolitis. We've had a couple of admissions, in fact, with bronchiolitis. There have been a number of children that have tested influenza positive. That's one thing that's bringing people in every day, with children with fevers, runny noses, coughs. So we're doing a lot of panels for influenza and something called RSV. And so I recommend to parents that if your child has a fever, if your child doesn't have a fever but is coughing, has a runny nose, is not eating, just doesn't look good, definitely come in to have the child tested for influenza and RSV if the child is wheezing, because that's something we're definitely picking up a lot of. And the CDC has talked about this, and even Riley Children's Hospital recently had a statement on TV that they're having a very high incidence of bronchiolitis, which is inflammation of the breathing tubes, because of this virus called RSV, which is similar in specificity to the influenza viruses. And it's been very significant this season. And come in and be tested, and then we can talk about what to do.
And we're still pretty early in flu season, right?
Yes, flu season lasts till April.
Okay.
And that's another thing that I urge parents to do, is get the flu shot for their children. And flu shots can be given from 6 months above. Some parents, there are a number of parents that don't believe in flu shots, and any flu vaccine will cause a little bit of discomfort the first 24 hours. But when you look at the long-term benefit of your child getting flu or RSV, it's well worth it in terms of the long-term benefits of not getting influenza or RSV, because child can be very sick. And I urge all my parents, when they come in, first question I ask, did you get a flu shot? And if they haven't, and if they're the right age, I give them a flu shot in clinic. And if they're not the right age, I will tell them next season we are going to do a flu shot for sure.
I know that you're fairly new still to Logansport, having just been here since November, but what have been your impressions of the community outside the hospital?
I haven't had much time to be outside the hospital, but everyone seems very nice. It's a small community, but everyone seems very nice, very polite, very helpful.
Now, how many patients do you see within your office? I mean, is there a maximum capacity for the pediatrician offices?
I'm trying to think.
I'm not sure about that. I'll
You know,
ask Vicki.
I'm trying to think because I've seen the panel numbers. I think that, and don't hold me to this, but I think that there's probably close to 12,000 patients that we
Wow.
call it a panel
Uh-huh.
that are assigned to the pediatricians in the pediatric center. But again,
That's a
you know,
big number, though.
it is a big number. I
Wow.
mean, people would be surprised at the number of patients that our physicians have as their panel. If they would hear some of those numbers.
Well, Dr. Segal, thank you so much for sharing some of your story with us today. Vicki, I know you have a couple things hospital-related that we could touch on before you leave today.
Certainly. Next month, I'm going to bring one of our general surgeons with me. I'm not really sure who will come, but we are in the process of beginning a new vein program, a vein service here in Logansport. Our general surgeons will be the surgeons that do that. And you'll be seeing some advertisement, press release went out yesterday for how to learn more about this. There's going to be what we're calling a vein clinic, an open house on January 28th at the hospital. So if you're interested, if you have issues related to veins disease, this might be a chance for you to come and learn more about the surgical options that will be available through the hospital and through the general surgeon's office. The other thing, I guess, that we've also just recently announced, it's scholarship time again for all high school seniors in our community. So if you are a high school senior and plan to go into the medical field, the Logansport Memorial Hospital Foundation provides 2 scholarships to high school seniors, and those applications are available in the guidance offices. I believe the cutoff date is April the 1st, so you just need to stop and get the application in the guidance office. You can also get them at the hospital as well, and then turn them in to the foundation office by the 1st of April.
All right. And last year you guys did a State of the Hospital.
We will be doing State of the Hospital probably towards the end of February, 1st of March. We like to get the end of the year closed out before we do that, and we're still in the process of closing 2013. So, yeah.
I know it's always exciting to hear the great things that are going on at the hospital. Yeah. So thank you, ladies, for coming in this morning and sharing some wisdom about Logansport Memorial Hospital.
Thank you.
Thank you.
And we will be back with more Talk of the Town.